Our blood has two very important jobs. The first, to deliver oxygen and nutrients to all the cells in our body. The second, to remove harmful waste. But then, once the blood is carrying waste, where does it go? That's when the kidneys step in. Blood-carrying waste products enters the kidneys by the renal artery. The blood cycles through special filtering vessels called nephrons, which pull out waste and water. The waste and water combine to make urine, which exits the body. Important substances like protein and red blood cells are too large to pass through the filters, so they stay in the bloodstream. The newly filtered blood goes back into circulation around the body. If this filtering system breaks down, we call it kidney disease. One of the leading causes of kidney disease in the United States is diabetes.
Diabetic nephropathy is the problem that arises when the blood sugar levels are too high and they affect the filtering mechanism in the kidney so that it can no longer work the way it's supposed to be doing, and therefore the poisons that are normally excreted in the kidneys remain in the bloodstream.
High blood sugar forces the kidneys to filter more frequently. Well, the kidneys already filter a lot. They filter all the blood in the body every 30 minutes. So filtering even more than they're designed for puts added stress on the filters.
If the blood sugars go too high in the body, the only way the body can handle it is by excreting that sugar in the urine. Therefore, what happens is that there's a lot of sugar in the urine and it's passing through the kidneys. And the high sugar content passing through the kidneys actually works on the tubules of the kidneys and adversely. And because of that, the kidneys just don't process the waste products in the blood as well as they should.
Diabetic nephropathy causes symptoms in the later stages. The first symptom is often fluid buildup, particularly swelling in the legs and feet. Later, symptoms such as fatigue, headache, itchiness, poor appetite, nausea, and vomiting can occur. But kidney damage can begin 5 to 10 years before that. Thankfully, it's possible to diagnose diabetic nephropathy during those intervening years. When the kidneys start losing their ability to filter the blood, they leave a telltale sign in the urine: protein.
If the tubules in the kidneys are not working well, then they're not reabsorbing some of that protein. So now that protein is being excreted, and your body cannot continue to heal up any wounds, to regenerate muscle tissue, to do all of those kind of things, because all of those compounds are now being excreted into the urine.
Not all diabetics develop kidney disease. It's influenced by genetics, blood pressure, and blood sugar control. Kidney damage is also more likely to occur if the patient smokes or is of African, Hispanic, or Native American descent. The better the control of blood sugars and blood pressure, the lower the chances of kidney disease. But it's not a given, so we're always on the lookout for signs of damage.
The nephrologists and I are such good friends because you have to monitor, and it's very interesting. There are several criteria that are put down for as necessary when you've got a diabetic. One of them is obviously to monitor the glycohemoglobin level over a period of 3 months. But one of the other things is the microalbumin level, the amount of protein in the urine. And you've got to do that once a year. If it goes above a certain amount, then you know those kidneys are not filtering the way they're supposed to be doing, and that's adversely affecting things. And that's when you really want to treat. There are certain medications that you can use to help prevent that, but if it's not, then you have to wind up sending that patient to a nephrologist to treat it.
It's important to conduct regular urine tests to find the kidney damage early, before symptoms have a chance to surface. Catching it early means we can keep the nephropathy from worsening.
Once the damage is done, it's very difficult to reverse it. If you see it, you want to try and maintain it where it is. You don't want it to get any worse. And that's why as soon as you see something going on, you want to make sure that the patient's being treated properly. One of the things may be to cut down the amount of protein in the diet, because now the protein is the major factor that's the kidneys can't work on. So you may want to cut down the protein content within the diet. You obviously want to get the blood sugars under as good control as you possibly can. But then, as I said, I wind up working with the nephrologist so that we can make sure that the patient's on the proper medications. Because there are certain medications that if the kidneys are affected, you don't want to give the patient, including certain diabetic drugs, which are contraindicated when the kidneys are not working the way they're supposed to be.
The most important thing a diabetic can do to prevent nephropathy is to control their blood sugar levels and their blood pressure. Do this by never smoking and having a healthy diet, engaging in moderate exercise, and adhering to medications. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.